Welcome to Introduction to Emergency Ultrasound. This tutorial will introduce you to the basic physics and knowledge of emergency ultrasound. So what is emergency ultrasound? As quoted from 2008 ACEP's policy statement on emergency ultrasound guidelines, emergency ultrasound is a goal-directed examination that answers brief and important clinical questions in an organ system or for clinical symptoms or signs involving multiple organ systems. For example, if we have a young woman who presents with a positive pregnancy test and abdominal pain and or vaginal bleeding, an ectopic pregnancy is at the top of our differential diagnosis. Our focused ultrasound question is an intrauterine pregnancy present? Yes or no? In a patient with a history of hypertension and hypercholesterolemia who presents with flank or back pain, a AAA is at the top of our differential diagnosis. Our focused ultrasound question would be, is there a AAA? Yes or no? In a trauma patient who presents with hypotension after blunt abdominal injury, we are concerned about intra-abdominal bleeding. Our focused ultrasound question is there free fluid in the abdomen? Yes or no? Now let's discuss some basic physics to help you understand more about emergency ultrasound. Ultrasound uses piezoelectric crystals that convert electrical energy to mechanical energy through sound waves, which are projected into the body. When the sound waves return to the probe, they are converted back into electrical energy. Electric current is passed through the crystals in the transducer, creating a sound wave. This pulse travels until it encounters a reflective surface, at which time only a fraction of the sound is reflected back toward the transducer crystals. When the returning echoes strike the crystals in the transducer, an electrical impulse is generated that is eventually converted into the images we see on the monitor. Echoes from superficial structures return more quickly to the ultrasound probe. Echoes from deeper structures take longer to return to the probe. Once all echoes have returned to the probe, an image is created on the monitor. This image is created within milliseconds. Audible sound ranges between 16 to 20 kilohertz. Ultrasound is defined as sound having a frequency above 20 kilohertz. In medicine, ultrasound used for diagnostic purposes incorporates frequencies that range from 2.5 to 15 megahertz. The probe on the left is a low-frequency curved probe, meaning it uses frequencies between 3 to 5 megahertz. Low-frequency probes have excellent deep structure imaging, but poor superficial resolution. They are often used for scanning abdominal structures. In the center of the picture is a high-frequency linear array probe, meaning frequencies between 5 to 10 megahertz. High-frequency probes have excellent superficial structure imaging and poor penetration to visualize deeper structures. These probes are great for imaging superficial structures like lung, vasculature, and soft tissue. The probe on the far right is a high-frequency endocavitary probe with frequencies between 8 to 13 megahertz. It is also excellent for imaging superficial structures. It is used in particular for imaging of pelvic structures and the eye, as well as to assess for peritonsillar abscesses. Echogenicity refers to the amplitude or brightness of the echoes returning to the ultrasound probe. If a structure is very bright, it is said to be hyperechoic or more echogenic than its surrounding structures. If a structure is darker than its surroundings, it is called hypoechoic or less echogenic. Isoechoic structures have the same echogenicity as their surrounding structures. Anechoic refers to the absence of echoes. Fluid-filled structures appear anechoic. A mode, also known as amplitude mode, is the most original and simple mode. In A mode, the probe scans a line through the body with echoes plotted on screen as a function of depth. B mode is also known as brightness mode. In B mode, an array of transducers simultaneously scans a plane through the body that can be viewed as a two-dimensional image on the screen. M mode, also known as motion mode, basically shows a B mode image of a selected section moving over time. Finally, there is D mode. This mode makes use of the Doppler effect, also known as frequency shifts, in measuring and visualizing blood flow. Types of Doppler modes include color Doppler, pulsed wave Doppler, and power Doppler.